The examples shown in the various animations are applicable for mobile C-arm systems with a flat detector, as well as with an image intensifier. X-rays are like light and are invisible to the naked eye because of their wavelength. The quality of the image that is created depends on the type and amount of X-rays that pass through the human tissue. As the X-rays travel through the patient, some are totally absorbed, some are deflected, and others pass through unaffected. It is the deflected X-rays which are responsible for what is called scattered radiation. This forms the exposure to the staff. The best protection from radiation is to maintain a distance as far away as possible from the source. The intensity of radiation is inversely proportional to the square of the distance. For example, by doubling the distance between the staff and the source of radiation from 1 to 2 meters, the dose rate decreased to a quarter of the original amount. The overall dose received is a result of the dose rate and the exposure time. It is also important to limit the area of the body exposed to the radiation source. The bigger the exposed surface area, the more radiation dose received. Therefore, the radiated area should be kept as small as possible with the use of collimation. Special requirements govern the construction of rooms in which X-rays are used. These rooms are defined as controlled areas and are marked with warning signs. It is advisable to wear protective clothing into controlled areas. This clothing, if worn correctly, provides protection from radiation. Local guidelines that prescribe the use and availability of protective lead aprons, thyroid protection collars, and protective lead glasses should be followed. Protective lead aprons can be effective only if they are worn and stored correctly. Badly stored protective clothing can become damaged and ineffective. By wearing a dosimeter, the overall radiation dose will be monitored. The recommended safe limits can be obtained from the local guidelines. The dosimeter should be worn according to local laws and procedures. Patient protective devices do not shield the operating theater staff sufficiently and therefore are not appropriate. If protective lead aprons with an open back are worn, one must always face the source of radiation if the source is activated. Before undertaking any examinations with the C-arm, it should be determined if the procedure justifies its use. Furthermore, a check needs to be done on how the unit can best be positioned to decrease radiation exposure. Furthermore, patient protection should be used where possible. The flat detector of the C-arm should be placed as close as possible to the patient. This proximity ensures that a full-scale and accurate X-ray image is created. The greater the distance between the object and the flat detector or image intensifier, the more the image quality is reduced. Also, avoid the use of thick silicone mattresses or pillows, as these act as fat tissue, increasing radiation exposure and decreasing the image quality. When the tube of the C-arm is placed under the table and the staff is facing it, the dose received of scattered radiation is reduced considerably. The same applies when the C-arm is used in an angular or lateral position. The person in charge of the procedure and the theater staff should always be positioned in line of sight of the tube. The use of collimation has a major influence on image quality. Modern C-arm systems have also been designed with integrated radiation protection devices. All the precautions shown in this presentation reduce the radiation exposure received by patients and staff. The radiation dose for the patient is further reduced with the use of additional filters. X-rays with lower energy, which do not contribute to the image, can be filtered from the useful X-ray beam. Most C-arm systems have a measuring field for automatic dose regulation, or ADR. The purpose of ADR is to automatically adjust exposure factors to create a compromise between a low cumulative radiation dose and creating a good quality image. The part of the body being examined has to be positioned on a metal-free area of the table. Introduction of any unnecessary metal into the X-ray beam can have a negative influence on the image quality and may produce elevated radiation exposures. Pulsed fluoroscopy reduces the amount of motion blur associated with moving objects. Lowering the pulse frequency makes it possible to reduce radiation exposure. The last image hold, or LIH function, allows the last image to remain visible for further analysis. Therefore, fluoroscopy is not required continuously throughout the procedure. The use of the mobile C-arm's measuring field produces a more homogeneous and high-contrast image, while the use of collimation has a major influence on image quality and aids in the reduction of radiation exposure to both patients and staff.